Test 1, 2, 3. Progress.
Good morning, everyone. I'd like to call to order the meeting of the Insurance Benefits and Ledge Committee for Wednesday, February 5th, 2025.
Thank you, Chair Robbins. This meeting is being conducted in person and by emergency teleconference under California Government Code Section 54953E due to the Governor's proclamations of a state of emergency relating to the Eaton fire and the Board of Retirement's determination at the January 15th meeting. I will now do a roll call of the trustees to confirm attendance. Ms. Ginsburg? Here. Ms. Durazo? Ms. Langton? Here. Mr. Rue? Mr. Oakham? Mr. Green? Mr. Moore?
Here.
Mr. Kehoe? Mr. Harris? Chair Robbins.
Present.
Participating in the meeting include CEO Santos Kryman, Deputy CEO Louis Lugo, AEOs JJ Popowich and Laura Guglielmo, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, Director Retiree Healthcare Cassandra Smith, Consultants Stephen Murphy, Debbie Donaldson from Siegel, Nikki Mangnall, May Young, Ryan Jones, Rich Hogan, Ryan Kewen, Shannon Haas, Allison Velarde, Maria Macias from United Healthcare. Trustees, please use the raise your hand Zoom option to be placed in queue. At this time, we ask all meeting participants to mute your mics until you are ready to speak, and we may now proceed with the agenda.
Very much. Item 2 is approval of the minutes of the meeting of January 15th. I'll make a motion to approve the minutes.
Second.
Are there any corrections or seeing none?
Ms. Langton?
Aye.
Mr. Moore?
Aye.
Chair Robbins.
I'm an aye.
The motion passes unanimously.
Thank you very much. Item 3, public comment. Now is the time for anyone from the public wishing to address the committee to do so. I don't see anybody present that would like to address the committee. We don't have anything in writing. We can move on to non-consent items. Item A, 2025-26 plan year health insurance rate renewals and benefit changes for LACERA's retiree health care benefits program. Cassandra.
Good morning, Mr. Chair, members of the committee. We are here finally this morning presenting the 2025-26 premium renewals for our retiree healthcare program. We initially started with an expected forecast increase of 10% or more. We're happy with the 6.3 for us to be a retiree population. That is a very good overall increase for if we got to have one, better than the 10%, certainly. That helped us save an avoidance of additional cost to the county of over $14 million. Is it your desire, Mr. Chair, that we go through each individual, or would you like me to just speak on the overall for each of the plans? Just the overall? I'll just do the overall, and if you have questions, then let me know otherwise. So our Anthem Blue Cross plans, and this does include the 1.5 million that we were able to receive approval from the county of the 1.5 million lifetime max. So the overall for Anthem Blue Cross increase of 7.2%, Cigna 7% increase, the dental vision increase of 3.7%, Kaiser an increase of 4.1%, 4.8% for the Kaiser out-of-state plans, Scan 7.6%, and United Health overall increase of 12.4%, which is how we arrived at the overall 6.3. You may recall, oh, let me go back. For the new trustees, our renewal process normally starts September, October. We'll request the initial proposals from the various carriers that we have. In December, a review of those proposals start, and that's when the negotiation back and forth to see if we can come to an agreement of some lower or address why the increase is as much as it's stated to be. And then in January, we have an all-day meeting with all of our carriers to address and finalize the renewal. So that's the normal process that we go annually for the premium increases or the renewal process. For those that were on the board before, you may recall our admin fee. We're continuing with $8 per member per month for this fiscal year, with the expectance that we will be reviewing that and increasing it next year. And we've already started that discussion with the county. Steve, I'll let you take it.
Morning, trustees. Steve Murphy with Seal Consulting. Bonnie, could we go to page 15? So, going to take some excerpts from the report so we can kind of focus in on some of the key trends and give you some insights into kind of the overall renewal process. So on this chart, we're showing what the current premiums are based on the current retiree count as of July 1st, 2024, and then looking at what we received as a preliminary renewal, and then ultimately what we negotiated as a kind of final premium. So what I wanted to highlight is really focusing on the Medicare and Medicare Advantage program rates, because as a retiree population, LACERA's ability to leverage kind of those subsidies available through the federal government really help extend the value of the program and extend the resources into the future. For Anthem Blue Cross Plan 3, which is a Medicare supplemental plan, the overall increase for that was 6.9%. If we go down to...
Recording in progress.
Some of my best lines earlier. For Kaiser, I can get that one. The Kaiser increase this year was 3.3%. Last year it was in excess of 10%. So they've kind of come back to kind of where they historically have been, perhaps even a little bit more aggressive than normal. So we're pleased to see that result. For SCAN, which is SCAN Health Plan, they primarily is a Medicare Advantage plan in Southern California, but they have expanded their territorial reach to include Nevada and Arizona. Cigna is no longer offering a Medicare Advantage prescription drug plan in Arizona. So we're anticipating as there'll be some migration with the majority of members moving to the SCAN plan, which would be a similar arrangement in terms of co-payments, et cetera, access of providers, with some choosing to go to the Anthem Plan 3, which is a Medicare supplemental plan. So we've made some assumptions in terms of migration, but just for context, the SCAN increase overall was 7.6%. So on the chart, when you see 24%, it's because we've added a number of lives to kind of that total, changing that look. But overall, it's a good position. And then lastly, for United Healthcare, the Medicare Advantage plan is increasing to 11.2%. As Cassandra mentioned, we have meetings with each of the vendors in January to review open items and questions related to those renewals. During those discussions, we had some lengthy talks about some of United Healthcare's projections for costs in the future. As an example, GLP-1s, which are used to treat diabetics and those that are obese with other chronic conditions, that can range anywhere between $20,000 to $25,000 per year for treatment. And with 40% of the population obese, you're seeing that really inflate costs. So we are seeing that there are new therapies in sector that are kind of built in or grow into the program that we have to account for costs. So that is kind of why the trend numbers for healthcare typically exceed regular CPI by perhaps 2 or 3 times. So as we're looking at that, we had some questions, at least relative to UHC's peers, why their trend numbers were so high, and some other assumptions. So we've had some lengthy discussions, and at this point, United Healthcare has decided to kind of maintain the rates that they're proposing. But I wanted to at least highlight that 11.2% increase relative to the other Medicare Advantage style plans that we're looking at. And Bonnie, if we could go to just one more exhibit. The county subsidy is based on the benchmark plans, which are essentially Anthem plans 1 and 2. They have essentially the same premium rate. The county will subsidize that premium up to that threshold. So as an example, a member with 25 years of service will essentially have no contribution as long as the plan they purchase is equal to or less than the benchmark plan. So in this case, what we're seeing is that historically the Cigna network model plan has been above the benchmark for quite some time. It is a very mature population If anybody remembers, the Cigna network is essentially the old Ross-Lewis plan that members had. I'm talking 40 years ago. My mom worked there, so that's probably the only reason I know that. But in the end, that population is very mature and unlikely to migrate to other plans, so not unexpected. But UHC has now eclipsed that benchmark rates. That means that members, even with 25 years or more of service, would have to pay a benchmark premium above that threshold. So for retiree-only coverage, that would be $111.90 per month. May not be a big amount, but again, when you've had no deductions for coverage, it becomes an issue. So again, we brought that to UHC's attention as well. And long-term, we think that that could have negative consequences on their membership enrollment. And so we did have discussions about trying to relook at that. And at this point, they've elected to kind of stay with the rates that they have proposed. And so what I'd like to do at this point is invite the UHC representatives to come up and just give a little bit more background on kind of where they're coming from and address any questions that the board may have.
Hello, everyone. Thank you for having us today. My name is Nikki Magnol. I'm a Senior Strategic Account Executive for United Retiree Solutions. I will be discussing the Medicare Advantage plan. And just listening to myself, I can really hear my accent today. So that's really grand to hear myself talk. So I also have our underwriting team available as well virtually. First and foremost, I would just like to thank you for the partnership that we've had with LACERA. I am a part of the day-to-day account management team. I lead the overall service team. And as Stephen mentioned, in looking at healthcare, we all know it's top of mind and we know what a complex system it is. It's a very different commodity than any other thing that we look at. And I'm sure that you all see on a day-to-day basis. And not only are we looking at dollars, but we're looking at helping individuals live healthier lives. So it really impacts us emotionally and personally, but then also financially. And where we sit with the Medicare Advantage plans is, although we are compared to our peers and competitors, we have been under a lot of scrutiny for the past 3 years with how Medicare has changed our funding and our methodologies, not only from risk scores in the medical coding, prescription drug. We've seen a lot of impact over the 3 years for the Inflation Reduction Act. We've had to incorporate, and then also plans have become richer than originally intended when they were structured. So in regard to the pricing, I understand that this year we're experiencing a higher increase than compared to our competitors. Previous years, we've been able to maintain stability for the plan. But as our funding has changed over the past 3 years, with the Medicare notice, we've just received our preliminary notice for 2026. And although we're seeing some reprieve, there are significant changes that are potentially in the works for Part D programs. So this is always going to evolve and this is always going to change. So when looking at the 11.2% increase that we are presenting, it is in part of the delivery of service that we provide to the individuals and to LACERA, but also in expecting what's to come. We don't know. We're trying to project out for costs that and impact to the plan that we're not aware of yet. So I will just pause to see if there's any questions.
Anyone?
Yeah, I want to ask a question at this point. Cassandra mentioned earlier that Anthem had included an increase in the lifetime maximum of our policies. And yet their overall increase was within the range of expectations. So they held their increased costs within the normal space while still giving us an additional benefit. Nothing that you said indicates that we're getting anything for this 11% increase, or I think it's 11 point something. Except you expect to be faced with some funding challenges coming forward. So everybody else is going to be subject to those same uncertainties as the way you characterize it. So that's not justification for raising your fees above what everybody else is doing, unless there's something I don't know, or that's not here, or that I can understand.
I understand. One thing I also wanted to clarify is that these funding changes are only impacting Medicare Advantage prescription drug plans. It's not impacting Med Sup plans. I forgot to mention that. But to answer your question, I don't have anything to solidify a response to your question in regard to our competitors. I don't know what, their expectations are. I only know what we are seeing and what we are projecting out from our actuaries and our financial team.
So what that means to me is you don't have any real support. You just have expectations looking forward. You want to pull in more revenue just in case you need it.
I will lean on Ryan Keene. He's on the phone. He's our director of underwriting, to add any additional comments.
Hey, Mr. Moore, can I jump? Can you guys hear me?
Yeah, I hear you.
Yeah, it's Ron Oakham. I think in the industry, okay, that's what's happening in the industry. In my individual Part D, I just got raised about 20%. And this is only on Part D, is that correct? It's not on the whole Advantage.
It's the whole Advantage, Medicare Advantage and Part D.
And what percentage is that? It's 11.2?
Correct.
Yeah, I think that's probably within range. And that's what's happening at darn medical business. But you guys explain it to him a little better.
Yeah, good morning, everyone. So my name is Ryan Keene. I'm the Vice President for Underwriting for United Retiree Solutions. So happy to answer some of this. So I think, as Nikki laid out, there's quite a few changes going on specifically within the Medicare Advantage industry, with CMS, the Centers for Medicare and Medicaid, and how they have been, frankly, cutting our funding over the last couple of years, while also mandating that we're delivering higher benefits due to the Inflation Reduction Act. So, the question was what's being offered that are additional benefits. With the Part D side, with the Inflation Reduction Act, there's now a significantly lower out-of-pocket maximum for members through that Inflation Reduction Act that increases the coverage. Medicare Advantage plans do not have any lifetime maximums or anything like that. We're not allowed to per CMS. So there are more benefits. And as we talk about premiums, if we take a longer term view of the overall premium, the through COVID and through the pandemic, it's been volatile with how funding works from the government. And the funding we receive is about 80% of the total costs from the government. So the premium you guys pay is about 20%. And so that gets a little bit leveraged as we think about how that's impacted. But if we go all the way back to 2019, our rate today is only about $30 higher per member per month than it was 6 years ago, which is an average annual trend of less than 2%. So, from specifically 24 to 25, we're seeing a higher percentage. And again, a lot of that is driven by industry factors, driven by the government. But if you look over a longer term period, our premium change has been significantly below what other plans have seen and what other areas of healthcare have seen, which I think just goes to show the value of Medicare Advantage and that it's still a really good program and a really good deal. It's just seeing a little bit more volatility right now from 24 to 25 as we're having to increase rates a little bit more from where they've been over the last couple of years.
Okay, let me just go back to something that your colleague said about cost increases only affect Medicare Advantage plans and not Medicare sub plans. Explain that to me.
Yeah, so that's a really good question. So the difference between Medicare Sup and Medicare Advantage is how the plans kind of function in relation to what the government pays. So a Medicare supplement plan is a secondary plan that just pays claims after the government has covered their portion. Whereas for a Medicare Advantage plan, we are actually receiving funding from the government for a percentage of claims, and then we pay the rest. The government over the last 3 years, starting in calendar year 2024, has implemented changes that effectively reduce the amount they are paying us for their portion of the claims by about 2% every year. And that 2% is meaningful because on average, we're talking about claims well north of $1,000 per member every month. So that 2% every year is worth at least $20 a year that the government is taking away in funding. And therefore, that has to fall to the premium to be paid since we're getting less from the government, and that increases our premiums. So again, over that period, our rates have only increased by, I believe, about $60 total over that time period with those government funding cuts, but it's directly driven by lower funding that we receive from CMS and therefore has to get passed through into our premiums.
And so this increased level of cost that's being shifted back to plan participants, it's not going to trend at this same level going forward. It's like a one-time bump, and then next year you go back to something more normalized because the environment.
That is our hope. I would say, the key variable there is obviously we have a new administration that just took effect in the White House. And for Medicare Advantage products, our funding and our rules of the road are set every year. So at this point, we know what was slated to happen and what has happened with that funding cut. And this is the last year of that. So we're hoping there is a more sustainable path forward beyond that. However, we can't guarantee that because we don't know what the new administration will do with funding and how that will take effect for future years.
So if we compared your increased cost to other plans that provide Medicare Advantage plans, we would see similar types of increases as those that you're proposing.
Across the industry, yes, and across the nation. I will fully admit I have plans, not to compare because each plan is unique. We have to price based on your membership, your own experience. CMS pays us different amounts for every county in the country. So different counties are going to see different things depending upon where your population resides. But there are absolutely plans across our country that have seen increases over the last 2 to 3 years on an annual basis that are double or even triple what you guys are seeing, because there has been a fair amount of turmoil in the industry. And if you listen to things like earnings calls or things like that from large insurers, it has been a very significant topic of conversation about how the funding from the federal government is not keeping up with plan costs and is driving higher premium increases. So you guys are not an outlier. You guys are not seeing more. And I would tell you, you guys are seeing actually less of an increase than a lot of our other clients that we deal with, because it is an industry-wide thing that is happening in Medicare Advantage right now.
So how do we explain that to our plan participants who have to pay $100 a month more now than they did before. How do we explain that to them?
Like I said, I think I go back to, over the long term, if you go back to where our rates were in 2019, and I know you guys had an administrative fee, and I understand there's percentages, that you guys pay versus the retirees. But if you go back to where our rates were 6 years ago, we were around $345 to $350, and now we're around $380 in total. So again, from 1 year to 1 year, I understand that increase is larger, but over a 6-year period, the average annual trend has been close to 1.5%. And frankly, I don't think there's anything anywhere else in healthcare, anywhere other plans are offering, or anything around us in other, sectors outside of healthcare that have seen cost increases of less than 10% total over a 6-year period. So I think, focusing on that longevity and that overall the plan is still delivering a ton of value. And we've been able to kind of manage that trajectory very well over the last 5 to 6 years. From my perspective, that's the path I would take. But I also understand, that's a difficult proposition for you guys in explaining to your, retirees with fixed incomes and things of that nature, specifically from 24 to 25.
Excuse me.
I see somebody else has their hand up, so I'm going to defer any questions.
Yeah, Mr. Moore, I just have a question. Can you hear me?
Yeah, I hear you.
Okay, I'm just wondering, a 25-year employee doesn't pay any, a 25-year employee doesn't pay any of these healthcare costs. It's our cost, unless I'm not wrong, Sandra.
Yeah, Mr. Oakham, that's what we're explaining, because Anthem Blue Cross is the benchmark plan. United Health's rates are above that. So that means that these people that have 25 years, for example, the retiree only, as of July 1st, will be paying $111, almost $112.
Oh, I thought that was just with Aetna. Okay. That's $111 an employee.
That's on top of what the subsidy is paid. That is in addition to.
And what about a retiree and a spouse?
Retiree and spouse, these are the non-Medicare rates, okay? Not the Medicare rates. These are the non-Medicare rates that are exceeding it. For the retiree and spouse, they will be paying $242 per month out of pocket.
So it's significant. Okay.
One other question then, Cassandra, the cost of a Medicare benefit, has that gone up? Is there a benchmark for that plan?
Not for our tier 1 people. For our tier 2 people, there is a benchmark for those.
Okay. And could somebody who's in an Advantage plan switch back to a Medicare plan now so they don't have that increase?
They can definitely go from a Medicare Advantage plan to the Medicare Supplement plan where their Medicare is not assigned. Yes, they can do that.
If they're in tier 1 and then they don't have any cost, is that correct?
Correct.
So should we then be prepared to explain what the alternatives are to their existing plan costs when those questions come up, that we have, a can that says, here's your options?
Well, Mr. Moore, I don't think we should be doing that because we don't have all the backup information to sit down with somebody. I think they have to call LACERA.
Well, that's what I mean. Not us personally.
Yeah.
I mean, LACERA.
Oh, okay.
I don't want to have to answer those questions.
Okay.
I don't want to have to answer anything.
All right.
Yes,
but there are ways around that, I think.
Yeah, I'm going to refer them to the staff because I will be, when I go to my monthly fraternity meetings, I got 8 guys who are retirees of LACERA. I don't know what their health plans are, but when they ask me questions, I want to give them the right phone number to call.
Just send them to Les. He knows it.
Okay.
So yes, our members do have the option, and what will happen is once they get this packet that we send out and they see that, our phones are going to light up. And their question is going to be, can they change plans? There are definitely other plans that LACERA offers that members can go to. This time I did not request approval to waive the waiting period. However, it's up to the committee and the board's decision whether or not they want to allow us to waive those individuals changing plans for this temporarily for this cause.
So when do we have to address that?
Mr. Kehoe, he's been waiting for
okay,
20
sorry.
20 minutes to talk, so
Okay.
Sean, you're up.
I've been very patient here, which is unlike me. So, okay. So number one, that was a lot of points were brought up, but I want to kind of synthesize it. Primarily, the United Healthcare is buckle up, because what's going to happen is you're going to turn into our Cigna plan. Our Cigna plan, unfortunately, is a dying plan that now the costs have exceeded anything that any member is willing to put up with. And they've all been migrating out of it. And the only ones are the folks that are the long-term holdouts that, as our consultant mentioned, 40 years ago have been a member and they're just willing to pay that money out of pocket. As soon as you exceed the benchmark, that's exactly what's going to happen. And we're seeing that $242 for a retiree on fixed income, they are not going to do it. They are going to switch right over to Blue Cross. And then what's going to happen is it's going to be a constant cycle. So then the next month, because memberships dip, and the ones that are going to stay behind are the ones that are having more medical conditions that are going to require them to stay, those costs are then going to increase, and the out-of-pocket costs are going to continue to increase. So it's going to be a constant cycle. And I think we're going to see the pre-65 United Healthcare plan go the way of the dodo. But that's a decision that United Healthcare is making. I just want them to understand, especially their underwriter who's sitting here doing the numbers. I want them to understand what that impact is going to be in the long term. Because they could go ahead, we could throw out all these numbers and percentages and talk about all that. And a lot of us in this room understand it, but our retirees do not. And our retirees they see the numbers and they're going to follow the numbers, especially when there are free alternatives out there. So the fact that United Healthcare's rates over the last 6 years did not go up, nobody cares. What they care about is that this year you have an 11% increase that kicks you over the amount. Now, I understand this is highly regulated. I understand it's very difficult to make adjustments, but I also understand that this is not in a vacuum and that things could be projected out slightly different than they were. Unfortunately, the decision was made to project it out to the point where you exceed the benchmark, and now we're going to have an ongoing waterfall of people that are going to be leaving the plan and going. That's just a statement that I have for United Healthcare, and that's what I said, buckle up. That being said, I was going to ask about the waiver, and I would like to include, I don't know, I'm assuming this is a motion that we're going to be ending up needing to take to the board to adopt the rates. So I would like to suggest that when we do the motion, that we do include the 6-month waiver so that people can choose to immediately change over to Blue Cross and to avoid this rate increase. So I would like to include that in the motion on our board.
So I'd just like to clarify, Mr. Kehoe, you're speaking of the, not the MAPD plan. What we've been talking about is the MAPD plan.
I'll clarify. We have two issues going on. For the Medicare Advantage plan, it's 11% increase, rounding. Okay. That's a cost that the county is going to incur for members of Pickett. So it's an additional cost relative to the peers that are offering similar products, Kaiser, Scan, et cetera. For the non-Medicare UHC plan, as Trustee Kehoe just explained, we're putting a lot of pressure on individuals to come up with funds, and I think we're going to find the members will seek out alternatives, and we'll likely see that enrollment drop. So I think neither scenario is ideal for UHC, but is the position they've staked out, and that's what they've offered for this renewal.
Thank you, and that's what I'm referencing, the rate.
So Sean,
So in any case, that's what I'd like to include in the motion, is that we waive the 6 months.
so Sean, you made a motion, and then included in your motion is to waive the waiting period. I'll second your motion.
What's that?
How much money?
Mr. Moore, do you have?
Don't talk about it.
No, I just said I would second it, but you already did it, so it's fine.
I just have a comment, and I mean, we've been down this road a whole lot of times over the years with our various plans, and I remember the year that some of our Kaiser plans exceeded the benchmark, and we had to deal with that. And I think the biggest risk here for UHC is just that there'll be some migration out of the plan. Some of these people, some of our lower paid retirees, that's going to be a big hit for some of them. So we'll probably see some movement. Not everybody will move, of course. People go into plans for various reasons, and I think the people that are in UHC are pretty happy with the plan. So you're just going to have to ride the storm, so to speak, and see what happens. Last year we got hit with a big increase with Kaiser, and the actives got killed in LA County with Kaiser last year. And I mean, they got killed with Kaiser. We didn't, but we still got hit with a pretty high increase. So, but nothing like what the actives had. So, you know, this stuff fluctuates and it goes up and down. And trying to understand, as Mr. Moore, we talked yesterday, and trying to understand all of the metrics that go into determining what these premiums are going to be is why we have people like Steve helping us, and you have your people, you know, as well. So it's complicated stuff. It's heavy lifting stuff. I wouldn't even want to try to predict what's going to happen now. New CMS people, Kennedy is going to be the head of HHS. Who in the hell knows what's going to happen? So, I mean, I think the healthcare environment in this country is very, very
Precarious,
I don't even know how to say it, but it's going to be interesting. It's going to be an interesting year. So, I thought all of our increases would be more than they were. Yours came in higher than we had hoped and that we had wanted, but I thought it was going to be double-digit stuff for just about everything, and it wasn't. So, but kind of
when do these come into effect? Is it July 1st or October 1st?
July.
Okay, and then we're going to waive the 6 months, and they can switch it, you know, in July without any penalty.
For the pre-65, correct.
Yeah. Okay.
And we've done that before, so that's not a big deal.
Yeah.
So,
Yeah. You're right.
and our members appreciate that. So, does anybody else have any questions on the motion or what's going on? No more questions. We have a motion and a second. Item 2, Sean, do you want to include, or do you want to make a separate motion on the $8 per member fee, admin fee?
Yeah, we should do that as a separate.
Can we make that all one motion?
Yeah.
So if we're going to do that, then can I just get clarification from LACERA staff? We are 100% certain that the $8 per member fee is capable of covering our administrative fees, and that includes forward thinking. That includes looking at any necessary expansions in your shop, Cassandra.
If you recall, last year we worked with the county and agreed to use surplus admin fee dollars to supplement what was over the $8. We still have funds in there that will cover the additional over. However, next year we will definitely need to look at increasing that.
It does need, it needs to go up.
Yeah. And we've already talked to the county about it, so we just have to regroup to get it all finalized.
Okay, so I'll include that in the motion.
Yeah, but if I just heard Cassandra right, there will be no increase this year because you have the money to do it that the county gave to you whenever?
It's in an account that we have that had surplus earnings. And all of the accounts that we have is basically the county money or the county and members money. So we're using that surplus to supplement the amount over the $8 rather than increasing it for the members the couple of years ago when we wanted to make that increase. So we're drawing down on that account.
Okay, so we really don't know how much to increase that because you don't have the new numbers.
I'm sorry?
I said, we don't know how much to increase that number because you don't have any new numbers.
Right, correct, because we look at the volume of people that are enrolled in the plan. That plays a big part of it. So
Yeah.
over this next year, we're gonna have additional people joining the program due to retirements and all, which will change that number. So we'll have a
Yeah.
better figure at that time.
Yeah, so I'd leave it, Sean, I'd leave it alone to next year.
Yeah, for sure. So I'm including the $8 in the motion.
Call the roll.
Mr. Oakham,
Yes,
Ms. Langton,
Yes.
Mr. Moore,
Yes.
Chair Robbins.
I'm an aye.
The motion passes unanimously.
Thank you very much.
Thank you for your time.
Now on to item B, state engagement, visit with California State Legislature. Mr. Liu.
Good morning, Chair Robbins and trustees. Yeah, so this is a follow-up from the presentation that our state lobbyist did last month. Just to recommend that we continue our visits to the state legislature. She mentioned that this past election, there was about a 25% turnover. So lots of new faces in the legislature that, we should meet and greet with and just to educate them on who we are and what we do. So last year, I recall that we had some very productive meetings that our lobbyists arranged with us and that Mr. Crime and Mr. Lugo have participated in. So we would like to do that again this year.
Okay. Anyone have any questions of Barry? Thank you.
Oh, and it's a recommendation. So
Okay.
Need a motion.
Hmm?
We need a motion.
We need a-
We need a motion. So Mr. Linton made a motion.
Okay.
I'll make the motion.
Second.
Mr. King.
You need the motion.
Yes.
I need a second.
Okay. Mr. Oakham,
yes,
Ms. Langton,
Yes.
Mr. Moore,
Yes.
Chair Robbins.
I'm an aye.
The motion passes unanimously.
Do you have any more, Barry?
for the next item with the engagement report, may I move on to that? For the next item is the engagement report. May I move on to that?
Sure, go ahead.
Yeah, so it's a item of interest for the committee this month. First item, of course, is the repeal of the windfall elimination provision and the government pension offset. So recently there was a letter from the chairman of the Ways and Means Committee to the Social Security Administration about this. The Ways and Means Committee is where the bill originated from. And the letter was just urging the Social Security Administration to swiftly and efficiently implement the law. The letter included a number of questions to the Social Security Administration, such as their plan and what sort of additional resources they need. As far as the the SSA is concerned, they are saying that it would take probably a little more than a year to implement this. The reason being that the repeal did not include a funding for them to implement this. So right now they're already understaffed and under budgeted just to do, handle the regular work. So this is sort of a special project on top of that. And so that's sort of the, at least the information we have so far from the Social Security Administration about sort of time.
I'm sorry.
Do you want anything?
Yeah, every time something comes out in the media on this, I read it, and all the unions are putting stuff out, and the firefighters and the cops are putting stuff out, and everybody's putting stuff out, and nobody knows what they're doing. And it's still going to be over a year probably, and nobody knows. I mean, I haven't heard any no one's really addressed the issue of retroactivity because they're going to go back a year or whatever, how that's going to work, lump sum, are they just going to add it? I mean, this is going to be a nightmare. So I'm getting emails every day from retirees. What have you heard? What have you heard? What have you heard? You know, and the answer ain't good. So stand by because it's going to be a long year. So.
Certainly, and the Social Security does have an FAQ page that they make regular updates to. They recently, made an update to it, I think yesterday. So I think we plan to maybe link that on our own website to direct members to. I think the reports are that the SSA is even getting like 7,000 calls a day about this. But again, it's a lot of this is informational, and it's information that's they themselves don't even, I guess, know. For the foreseeable future. Next item is regarding Alaska, which over the years has tried to reinstate their pension plan that they had terminated back in 2006. So you may recall last year, there was a bill that stalled that's carrying over this year, but then another bill was just recently introduced. So they have two bills right now to try to reinstate their pension plan. The current bill is offering members a choice between defined benefit versus defined contribution plan, whereas the prior bill that's carried over would just mandate people go into the defined benefit plan. So again, this is still evolving. Lots of, I guess, tensions between the need for retention and recruitment versus just the cost of reinstating the plan. And then the next item is Pensionomics 2025, our friends at the National Institute of Retirement Security, they do probably a 2-year update on this. So the current update just talks about the economic impact of pension plans on a nationwide basis. There's about $680 billion in pension benefits that are paid to 26 million retired Americans. And that's spread across state and local and the federal government, as well as the private sector, which, again, we know that there are fewer and fewer members going into private sector pension plans, but there's a large number of existing members as well. So surprisingly, there's about over $217 billion that are still being paid to 11 million retirees in private sector pension plans. As far as California is concerned, there's about 1.6 million residents that receive over $68 billion in pension benefits. Average monthly benefits about $3,500. And those expenditures result in almost 400,000 jobs that are supported by $20 billion in wages that those pension benefits, have an impact on. And it also results in about $16 billion in federal, state, and local tax revenue. And the last item is kind of drilling down more on, what does retirement look like on a pension itself? Wall Street Journal has a series of articles on this, and the current story looked at people on a pension, both a public sector and a private sector pension, and it mentions that people with pensions just report a higher level of satisfaction as opposed to relying on a 401k. It's just that peace of mind in terms of retirement security. And although a 401k, you might be able to make more wealth with that, it requires more active management of that. Whereas, as we know, especially with public sector pension plans, those are managed for the benefit of the members. The drawback to pensions is that generally you have to stay decades with an employer, so that may not line up with current job patterns where there's a lot of job changes. But I thought it was a clever quote in the article from Oscar Wilde that said, "It's better to have a permanent income than to be fascinating," which I guess interesting message for today's social media influencers. But one person they profile in the article is a 71-year-old Californian who worked for the state, so hence he got a CalPERS pension. He did work for the private sector at one point, which went bankrupt, and so his pension from that company disappeared, but he ended up working 25 years for the state. Look at his numbers, he gets about $6,000 after taxes in his pension, about $2,200 in Social Security, which is above the $1,400 average, and then savings about $110,000. So these are pretty average, I think, numbers as far as the three-legged stool of retirement security is concerned. And he's also get healthcare coverage through the state, as well as through a medical supplement plan. But ultimately, he's happy he doesn't have to work anymore and has that pension for his peace of mind. So that concludes my report. Happy taking your questions.
Anyone have any questions for JP?
Yeah, could you just explain the difference between each dollar paid out pension supports $1.27 in total economic activity and the $4.30 total economic activity to the money invested? What's the difference between those two?
Yeah, so the $1 to $1.27 economic activity. So the first one is pension benefits paid to members that result in $1.27 in economic activity. The other number is each dollar invested by taxpayers. So
I get that.
Yeah.
I see that distinction. I just don't quite understand. So how do you define economic activity, particularly for the amount invested?
So that's I would defer to an economist for that, but generally in economic impact studies, there's a definition for that in terms of that impact over the wider community and I guess society.
I mean, I get the general concept, but
Right.
I'm kind of going, yeah, all right, sounds good. It's all in our favor, but thank you.
Thank you very much. And that concludes your report.
Yes, thank you.
We will go to item B, staff activities report. Cassandra.
Yes, Mr. Chair, just to report, retiree healthcare is completed, processing about 335 domestic partner 1099-R tax forms for the members who cover their domestic partner. If you recall, the federal government does not recognize does not recognize domestic partners, and so they must pay interest on the federal funds, the federal portion of their county contribution. So that's what that 1099 is. It's a separate one from their pension 1099. So those have went out as of mid-January. That's it.
Thank you. Item C, Steve, claims experience.
I could handle C and D combined. So
Sure.
item C is the claims experience summary that we present monthly. I won't go into detail on that today because we've gone through the renewal experience, which is really kind of the purpose of looking at this on an ongoing basis. So we'll do an update next month and go in a little more detail. And then on the legislative update, our compliance team in Washington, DC prepared an article on January 21st, the day after inauguration, about things to look for in terms of initiatives in managing healthcare and tax spending, et cetera. I don't know about you, but I don't know if it's worth the paper it's written on today. With so much having changed and gone on, and we'll keep you updated, but I don't think any of us have any kind of crystal ball as to what the next step is and where we're going to go. So it will be an exciting year. And that concludes my remarks.
No news is good news. Okay. That concludes item D. We're on item 6, items for staff review.
I have nothing.
We don't have anything. Items for future agendas.
I have nothing.
We don't have anything. Good of the order, we'll hold that over to the end of the Board of Retirement meeting, and I'll accept the motion to adjourn.
So moved.
We are adjourned. Board of Retirement. About 10 minutes.